The New England Journal of Medicine came out and said that climate change is a public health emergency. And so when we are operating in a sort of circumstance where climate change is a public health emergency, it's really important to understand how coal specifically contributes to the harms that are caused by climate change. As a process of mining, the coal is broken up and carried away out of the mine. And as those bits of coal are breaking off of larger bits, that creates dust and particulate matter.
Coal plants in particular, but other industries as well, put dust out into the air, and these dust particles are very small, and they're measured in microns. So something like 50 microns is the thickness of a piece of hair. Particulate matter that's particularly 2.5 microns is very harmful because a lot of times, just our nasal hairs or the mucus in our mouth will catch most particles. But if it's 2.5 microns, it's too small. It'll just keep on going right down the nasal cavity, right into the lungs, right into the alveoli, which are little air sacs, and stiffens them up.
I grew up in Salem, Massachusetts, where there was a coal plant throughout my entire childhood. In high school, when I joined the track team, I started realizing it was getting harder for me to catch my breath at the end of races. At the same time, my mom was noticing me having a little bit more trouble breathing, even when I was just sitting down. There were days where I just felt like I had to take really deep breaths in order to have enough oxygen. So we ended up going to the doctor's office. I had a couple of visits before they finally realized I had asthma and gave me an inhaler, taught me how to use it, started bringing it to practice. And that's when I realized that I was not the only person on my track team who had asthma.
The coal plants are a major culprit in the emission of mercury. It is a very serious neurotoxin, and you want to limit it as much as possible. Been well recognized since, the Merrimack incident back in the 1950s in Japan. Looking at, before and after picture from a lake 20 miles upwind of the plant and then 10, 20 miles downwind, you saw a dramatic difference in the levels of mercury. The state did issue a fishing advisory back in 1994 telling everyone to limit their consumption of fish, and particularly vulnerable populations, that women of childbearing age, women who are pregnant or going to become pregnant, and small children need to limit their consumption to 1 meal per month. To this day, 30 years later, we still have fish advisories.
People that live in areas where there's more particulate matter, particularly of 2.5 microns, have higher rates of COVID and have worse cases of COVID and are more likely to die from this. People that have chronic lung problems, or even people that don't have them, can get them from this particulate matter.
Statistically, communities that live in proximity to coal plants have greater rates of asthma and other lung-related ailments. So I realized I was part of that statistic. Realizing that the company that owned that coal plant was making all these profits while people like me were getting sick from this coal plant was really hard to wrap my head around at first.
And nobody should have to suffer from, lung disease because of the air, We released a number of studies starting in early 2000s done by the Harvard School of Public Health. What they found is that the pollutants from these plants lead to the premature death of up to 160 people per year. It's killing people. Right. It's shortening people's lives. And this is mainly from the particulates, the sulfur pollutants that get in your lungs and lead to heart attacks, lung disease, asthma, etc. So they were able to quantify that for the first time. And I think that finally kind of brought it home to people that coal kills.